My name is Dr. Shah. I'm a board-certified plastic surgeon with a subspecialty board certification in hand and upper extremity surgery. I'm the chief and medical director of the Center for Hand and Upper Extremity Surgery. Sometimes patients who have nerve issues, nerve compression, nerve injuries may have had surgery and they may still be suffering from the same symptoms that they had previously, or maybe even potentially a little bit worse. At the Center for Hand and Upper Extremity Surgery, we have surgeons who specialize in peripheral nerve injuries, peripheral nerve compressions, and we can actually help take care of patients who may have had surgery for a condition that's still bothering them significantly. As an example of peripheral nerve issue that may still be causing patients the same type of problems or even worse is what we would call a failed ulnar nerve surgery or a failed cubital tunnel surgery. A patient may have a surgery where the ulnar nerve was decompressed, or maybe it was moved to the front of the arm, and that type of surgery potentially can lead to having more issues with the ulnar nerve, having more pain, more dysfunction, or even more problems in moving the hand. Many times we have patients at the Center for Hand and Upper Extremity Surgery who come to us with previous ulnar nerve surgery or cubital tunnel surgery, and we tell them that they probably have either new areas or persistent areas where the nerve is crushed or kinked. In that scenario, we'll counsel the patient that you likely need another surgery, in which we're basically going to find the nerve, find out the areas that it's either continually being crushed or maybe being kinked, and we'll release those crushes, release those kinks, and put the nerve in a healthier position, oftentimes under some of the muscles in the forearm. It's a surgery that we do commonly, and many of our patients feel tremendously better. If you're experiencing a significant amount of wasting in the hand, you may actually get what's known as a nerve transfer surgery, where we basically borrow a nerve that you don't need and use it to supercharge the ulnar nerve that's not working very well, basically trying to boost the functionality as you're recovering. Secondary ulnar nerve surgery recovery is usually a bit more intensive than your first surgery. It's usually a larger surgery where we may have moved the nerve, put the nerve under some muscle, done a bit more work inside your arm, and that leads to a little bit more recovery time than the first sort of smaller surgery that you may have had. So you may be moving the elbow with physical therapy in a little bit more intensive fashion. Generally speaking, patients feel significantly better after the surgery because the crush or the kink has been taken away, so they may actually feel like their recovery is not as prolonged as they were expecting. When I see patients at the Center for Hand and Upper Extremity Surgery with persistent ulnar nerve problems or worse ulnar nerve problems than they had before they had their surgery, I know for a fact that they're going to be some of the most patients with significant pain and disability. If you have surgery or a procedure done to revise a failed ulnar nerve surgery or fix your ulnar nerve problem, our expectation is you'll feel significantly better and get a lot more function back out of your arm. We want you to have surgery with us because we take care of this problem more frequently than many other providers out there, and we know and we have the expertise to take care of a difficult problem like a failed ulnar nerve surgery from the beginning.